Welcome to the new Congress, and Mr. Krishnamurthy, we appreciate you being here and being the ranking member. And we'll, if you'd like, we have Mr. Mitchell, and I know a number of other new members to the Oversight Committee will be joining us from potentially the Democrat side as well. So, want to welcome Mr. Mitchell to the committee this afternoon. Let's start with opening statements and get right to our witnesses. And we appreciate our witnesses being here today, talking about an important subject. Health insurance premiums are soaring. President Obama and the administration promised multiple times that the Affordable Care Act would lower health insurance premiums by $2,500. American families are still waiting to see those reductions. Instead, the health insurance premiums have skyrocketed under the Affordable Care Act. There's been about a 25% average increase in premiums just this year. Some Americans have experienced even higher premium increases and had to drop coverage because it became just too darn expensive. Under the Affordable Care Act, they're not just rising premiums. Many Americans have also seen massive increases in the cost of their deductible. Healthcare costs are one of the top concerns for families, and even people with insurance oftentimes can't afford to use it, especially individuals enrolled in high-deductible health plans under the ACA. There were promises from the administration about increased competition. In fact, though, in most parts of the country, there are only one or two insurers participating in the health insurance exchange in 2017. Insurers are seeing unprecedented losses on the exchange. Losses on the exchanges are reaching into the billions of dollars for the health insurance industry. As a result, several large insurers are pulling out of the exchanges. According to the Heritage Foundation, before the ACA was implemented, there were 12 insurers participating in the individual market in North Carolina. Today, only 2 insurers are participating in the exchanges in that state. In many areas of North Carolina, there's only one insurer selling coverage on the exchange. And finally, of course, we cannot forget the Affordable Care Act was sold as one of the biggest political misleading statements of all time. If you like your plan, you can keep it. If you like your doctor, you can keep your doctor. Even the president had to apologize for that one. As we examine health care reform proposals, it's important to keep these realities in mind. While millions of individuals receive health coverage under the Affordable Care Act, many more are being harmed by the skyrocketing health care costs. Today, I want to hear from the Health and Human Services Inspector General and the GAO on implementation of the Affordable Care Act and their recent and ongoing work in this area. Both of these agencies have done excellent work reviewing the Affordable Care Act programs and activities, and I want to hear their recommendations on how we can use lessons learned from implementation of some of these programs to improve future programs. The work of HHS OIG is critical to ensuring the integrity of Health and Human Services programs, and I'm constantly impressed with the great work that comes out of their office. I look forward to hearing about the OIG's work relating to the Affordable Care Act. Thank you, Mrs. Robinson, for testifying on behalf of OIG's office today. General Accountability Office has also done great work examining the early impact of the Affordable Care Act on private health insurance markets, and I look forward to learning more about their findings. So thank you, Mr. Dickin, for testifying on behalf of GAO today. And we're also pleased to have Mr. Jonathan Siegel here with us today to hear about his experiences under the ACA. Thank you again for your willingness to be here and to testify. I look forward to the discussion today. Congress needs to find a way to help make sure Americans have access to affordable health insurance and can choose among a variety of plans. With that,